Endometriosis is a condition in which tissue similar to the lining of the uterus begins growing outside the uterus. To understand endometriosis, it helps to first understand what normally happens during the menstrual cycle. Inside the uterus is a special lining called the endometrium. During the first half of the cycle, estrogen helps this lining grow thicker in preparation for pregnancy. This thickened lining is meant to support a fertilized egg if conception occurs. If pregnancy does not happen, hormone levels begin to change. As estrogen falls, the endometrial lining begins to break down. That tissue then leaves the body during menstruation. In a typical cycle, the blood and tissue have a clear path out of the body. This is the normal process the body is designed to follow each month. In endometriosis, tissue similar to the endometrium appears outside the uterus. These growths may appear on the ovaries, pelvic lining, or other nearby structures. They can also involve the fallopian tubes, intestines, or bladder. In some cases, endometriosis may even affect areas outside the pelvis. Just like the normal uterine lining, these misplaced tissues also respond to hormones. As the cycle progresses, they can thicken, break down, and bleed as well.
But unlike menstrual blood inside the uterus, this blood has nowhere to go. That repeated bleeding irritates surrounding tissue and triggers chronic inflammation. Over time, this ongoing inflammation can damage the tissues around it. The body responds by forming scar tissue. These scars can become adhesions, which are bands of tissue that make organs stick together.
As adhesions grow, the normal anatomy of the pelvis can become distorted. This can limit organ movement and create tension, pain, and abnormal positioning. Inflammation and scarring are major reasons why endometriosis can be so painful. Sometimes endometriosis leads to cysts forming on the ovaries. These cysts are called endometriomas, often known as chocolate cysts. They contain old blood that is collected over repeated cycles. Together, lesions, inflammation, cysts, and adhesions can create significant pelvic pain. That pain may be worse during menstruation, but in some people, it can become constant. Endometriosis can also affect fertility by interfering with the normal movement of the egg. If the tubes are scarred or displaced, the egg may struggle to travel toward the uterus. This distortion can make fertilization more difficult and may contribute to infertility. In more severe cases, surrounding organs can also become affected. When the bowel is involved, pain, digestive symptoms, or even obstruction may occur. If the bladder is affected, it can lead to urinary discomfort and other complications. The exact cause of endometriosis is still not completely understood. One widely accepted theory is called retrograde menstruation. In this theory, menstrual tissue flows backward into the pelvic cavity instead of fully leaving the body. Treatment may include pain management, hormone therapy to suppress estrogen, or surgery to remove lesions and adhesions. Although endometriosis can be painful and complex, understanding how it works is the first step toward better treatment and support.